When I was planning to move to Mexico, one of the things that my family and friends talked to me about or asked questions about, they were like, what if he gets sick? What about the health care? That assumption that Mexico does not have quality health care. Others assumed I would fly back to the United States for any medical care. Well, I do live in Ensenada. I'm only 2 hours away. So that was a consideration. That was one of the reasons I picked Ensenada based out of, those concerns. And I have to be honest, my fears. After living in Ensenada, I've learned so much. And the reality versus the fear was quite different. And today, that's what I'm going to talk about: the medical system and a little bit about insurance. I'm Purple, and welcome back to my channel. I left Chicago. For those who don't know, I left Chicago and moved to Ensenada, Mexico, and I've been living here for 3 years. And the purpose of this channel is just me living boldly, but also assisting anyone who is interested in moving in Mexico, is giving you a little bit of my knowledge. I travel, I live life to the fullest, and I share it with you. So let's get started. In understanding the healthcare system in Mexico, you have to know the different healthcare systems. First one is the public healthcare system that is funded by the Mexican government, that has pros and cons. Pros: low cost to no cost. Major surgery is included, and hospitalization and specialists. Those are the big pros. Cons: you're going to wait. You're going to wait a long time. A lot of their equipment is not as modern or needs repair. I mean, same as in the United States. You go to a public clinic in the United States, it's not going to be the same as the private. The same thing here. In the public sector, the staff tends not to speak English as well or as often, and you have less choices of specialists. So the next type of care is private health care. You either pay out of pocket or you have a private insurance. The pros for private health care are shorter waits, more modern care, availability of more specialists, and many of the doctors and staff speak English. The cons are cost, high cost, whether you're paying it out of pocket, higher cost, I would say, whether you're paying it out of pocket or you have an insurance. And insurance is very costly for people over 60, just to let you know. And also, you can have cash pay. I've done cash pay. A neighbor of mine recently had to deal with the healthcare system in cash pay. She had an emergency. She got injured. She had to go to the emergency room. And I interviewed her. This is what happened. Hi, guys. I'm here with Luana. And a couple of days ago, she had an accident that falls right into this video. What happened?
So I was moving my bike and my motorcycle, and I was doing it pretty dumb way to do it.
She's a biker chick.
And it tipped over. When it tipped over, either the foot peg or the kickstand scraped my leg, and it was big enough that it had a pretty big gash in it. So I ended up thinking, yeah, I need stitches. So I had messaged a couple of people and asked them, can they recommend a hospital, and a couple of people recommended the same place, Clinica San Jose. I went in the office door because I thought that was it, but they said, no, go next door to the emergency room. So I went next door, and nurse was there right away and asked me what was wrong, took my information, and I had also put it in Google Translate that, I cut my leg, I probably needed stitches. And she spoke some English, and then she said the doctor, who's Dr. Torres, spoke really good English, which
Okay.
was good because my Spanish is not great.
Yes, we struggle. Me too. Yeah.
So anyway, he came over, looked at it, and said, "Yep, you need stitches. So come on over here." And they cleaned it really good. And
How many stitches?
I think there was about 6.
Okay.
So yeah.
All right. And what's the follow-up?
I go back in 7 days, and he takes the stitches out and
Okay.
just double checks that it looks okay. And he also wrote a prescription for some antibiotics just to be on the safe side, to not get an infection. And just went to any pharmacy and picked those up.
And he gave you pain pills too, right?
Yeah, ibuprofen.
Yeah, but you said you
I
didn't
didn't.
need
No, I didn't need
because
it.
you're tough.
So yeah. Well, also I have ibuprofen here. So
Right. Well, I didn't tell you, Luana is a neighbor of mine, and she's really kind of new to Ensenada. When did you got here about?
year ago
Yeah.
to Ensenada. Yeah, because we've been living in San Felipe, which is on the other side.
Right.
Yeah.
Right. And so she didn't know where to go, and that's where community comes in when we live in Mexico, because we help each other out, and they told her where to go. So the hospital that you went to, how would you rate the care?
I thought it was really good. I mean, it was, everything was sterile, because people are always like, oh, well, what
Yeah,
do
they think in
have?
Mexico,
So
right.
no, everything was sterile. They undid everything just like in the U.S. or
Mhm.
wherever, and the people were really nice, and it was
Professional.
very professional. And so a doctor, had been working there for 3 years, he said.
Okay.
So yeah.
Right. Do you mind telling us how much it costs for that hospital? Because you paid out of pocket, right?
Right.
How much it costs for the hospital visit?
It was 2,000 pesos.
All right, 2,000 pesos is equal to this. I gotta look it up, but this is 2,000 pesos. And your prescription for the antibiotic?
It wasn't. I don't think the prices on the ticket they gave me. So,
Okay.
but it wasn't that much.
It wasn't
money.
expensive?
No,
Okay.
no.
All right. How's your leg feeling?
It's good. I mean, it's bruised, and the bruise.
Yeah, I see the scratch, like where
Yeah.
the chain scratched it or something.
That was probably the foot peg. So yeah, it's
Okay.
like
And
an
it's
L
bleeding,
shape.
it's
It just a
just
teeny
a
bit.
teeny bit.
Yeah, and he
Okay.
gave me antibacteria spray I got from the pharmacy also. So he said do it, twice a day. Wash it with soap, and then spray it, and put a new Band-Aid on it. So.
Well, this fits right in, and like I was telling you, the video that I'm working on, trying to give subscribers an idea of what the cost is medically, and you don't have to have insurance unless right. You don't have to have insurance because it's very affordable.
Yes.
Yeah,
it is.
So I want to thank you for sharing.
Oh, you're welcome.
All right, and opening your home. Mark, do you want to come say hi?
Hi.
We need you over here. Oh, when we were talking about Mark, this is her husband, Mark. He's a sweetheart. Thanks, Luana. They're a gas. She's a biker chick. I mean, she's really tough. You should see her. It's admirable, because I'm not riding a bike like that at 60, but she got it down pat. I'm going to talk about Ensenada in particular right now. Ensenada has 6 public hospitals within the city and city limits. Example, they have 8 to 10 private hospitals. Actually, the 2 that I have a picture of up there, I've been to both of them, so I could talk about that. And they also have military hospitals. One of their military hospital, military personnel get to go there free of charge, but they do allow the general public to come, but there is a fee. Don't know very much about that, but I just know that it exists. Now, let me just say, Ensenada can handle pretty complex medical cases in their hospitals. However, highly specialized care and hospitalization, let's say open heart surgery, transplants, things like that, I don't think Ensenada would be the place to have that done. People tend to go to Tijuana, Mexicali, or Mexico City if that's warranted. So Ensenada is a small town. All right, let's go over some medical health care insurance options. Traveler insurance, traveler's insurance with medical coverage that is available for basically anybody, expats. Unless you have a catastrophic event, you're probably going to be able to pay out of pocket. But if you have an unexpected diagnosis like cancer, kidney problems, heart problems, those bills are going to start to add up. And you're going to need some kind of private insurance at that point. Now, I want you to know this, that most Mexican insurances do not cover pre-existing conditions. So don't wait till you get sick to get the coverage. If you're going to get the coverage, you need to get the coverage now. For me personally, that's why I live a little close to the United States, because if I get sick, part of my insurance portfolio is evacuation, is medical evacuation. So I can be medically evacuated to the border or to basically any hospital in the United States that I want to go to if I'm having an emergency. That's only in an emergency situation. But I live close enough to the border that if I have a chronic condition or if I get really sick, as long as I can make it 2 hours away, I'm okay. And that medical evacuation insurance that I have, that's for anywhere in the world. I had that prior to coming to Mexico because of my extensive travel internationally, and I still have it here. The private health insurance, you have to either be a citizen or a temporary or permanent resident of Mexico. It is costly. I am looking at my notes really quick. The cost will depend on the benefits that you want. You can visit any private practice, just like private health insurance in the United States. But your premium is based on these particular factors: age, amount coverage, hospital level, gender, sex, deductible, address, so where you reside in Mexico, and whether or not it's an international or a national coverage. Like I told you, I have international insurance. You could have a national just for Mexico insurance. So it depends on your preferences. Because I know my audience tends to be an older audience, I'm going to talk a little bit about Medicare. And I'm reading from my notes right now because I don't want to mess this up at all. Medicare generally does not pay for health care in Mexico, but there are exceptions. I'm not going to go on those exceptions, but there are some exceptions, but they're very few. So do not depend on Medicare to take care of your bills. Well, I hope that this was beneficial to someone. All you have to do is be beneficial to one person. And thank you. Thank you for stopping by, and I'll see you next Sunday. Bye bye.